So mine is how I look at the moment, and it's fine. It's not what this is about. I just want to come here to document some of my ideas for my end of my externship evidence-based practice project. So I need to figure out how I can facilitate that into finding something that is proven to help and see results. But what I want to do is I want to do a documentary. I want to do a documentary called The Circle. The circle meaning the path or the pattern that many of our patients or friends or just fellow human beings experience on a daily basis of going through and facilitating their mental back up. Sorry, we're gonna redo that. So the circle is about our patients or our humans or our fellow neighbors or our friends or our family that struggle with severe mental illness. And at some points, yes, everything's under control, but with some of these severely SMI patients, there's, regardless of drugs, I mean, as we know, like, it can take years to find the right combination of drugs that actually work. So many of these patients struggle, and they struggle with addiction. They struggle with finding a sense of complacement, homelessness, and this project is to share light of the struggle that they have to encounter completing the circle. And it's not to exploit them. It's to show people how, and nurses and people that practice, in our field, that, how we can have a more compassionate light. And you don't really know until you're there, right? So I just had this idea of, when I was doing acute psych care and when I did my clinicals, I noticed, in many of the units, there's always patients that are considered psych patients, but whatever they come in for, it doesn't matter. And after their physical needs are met, then comes their mental or psychological needs. And a lot of times, what's the next process for that? There's a kind of a void or an urgency to not really avoid to not treat them to their fullest capacity, and an urgency to move them on so we can, get that bed open, which, in idealistically is kind of the component of trauma care. So let's say this patient is fine physically, but emotionally they could be, off their medications, or maybe they don't have access to healthcare, or maybe they forgot to take it. I mean, there's many different reasons why people could be in these kind of states, but those, just like there's a trauma and the medical field, whether it's like whatever, maybe a stroke, heart attack, there is trauma in the psych field. And what I've noticed is that transition of going from the medical component and so then, next there's things like getting petitioned, or, the provider, the psych provider doesn't think that they're ready to be out wherever they're supposed to be, or they're not properly medicated, or maybe they're experiencing mania, or, they're schizophrenic and they haven't had their medication, so they're experiencing delusions, which can be very harmful for themselves and or others. So, it's this whole systematic way of like, okay, we're done here. Now what do we do with them? And now coming in from the other, as the circle process is always evolving and going back. So now they're going to the acute psych facility, or wherever they're ordered to be, whether it's court ordered or family ordered, or, their provider thinks it's best for them. Then they go and receive a different type of care. And a lot of times they just complete the program. They just, go for their 5 days, get their, injection of Invega or whatever they're on, do all the steps and fill all the pieces of the puzzle. And then, whenever they're, normally it depends on where you're at and what state, but, psych holds a court order can be 7 days, or whenever the provider feels like they're ready to go back into society. Well, what happens is a lot of times, okay, so we've got them back onto a stable level, and we're ready to. They're doing their work. They're experiencing less of whatever brought them into that facility, that psych facility, acute one care at that time. And then it's like, okay, well, even if you have insurance, you don't have insurance. Well, your time's up. Your time's up. Okay, so we're gonna, place you wherever that might be. Sometimes there's not really a place, and social workers and hospitalists and all the people involved work so hard to, provide opportunities and somewhere to go for these people. But really, like, there's a lot of components that are integrated in that, and that includes, whether they have the finances or resources, or they want to be there. A lot of times at my days in the psych facility, I would always ask, as a tech, I'm always there with the patients, and I was always there with some of the most severely, mentally sick patients, and I would be like, okay, so you got this place to go, like, or, whatever the next step is, and they're like, yeah, no, I know I'll just end up back on where I came from. And to me, there's like a lack of, as you would say, evidence-based practice for how do we fix this problem? How do we fix this problem of, somebody that's always completing the circle? So that's what this documentary is about. And my mission statement is to further investigate evidence-based practices that we could use with a collaboration of not only like your physical hospital, but maybe your psych hospital, maybe your social work resources, or your hospitalist or whatever. But just finding evidence-based practices that show us how we can prevent the circle from happening. And when I was in the psych facility, I had many patients, like in my year that I was there, that I worked there, and I think I've seen them like 7, 8, 9 times, 10s, and they always went to the same. It always started out like, whether the law enforcement was called or their family called or whatever, they would be taken to a medical facility, whether that be somewhere in the area in where I live, Valley-wise, or those places, and county. And then, okay, well, physically, okay, we've treated your whatever, maybe, because a lot of times it's just, if you're severely mentally ill, like your Maslow human needs are not met to yourself. So we've taken care of their physical ailments or their physical problems. But okay, so we're done with that. Bye. Let's just ship you on. So then they show up to the acute psych facility, and they have, a lot of times they've been petitioned by whoever, their clinic or whatever it is, and they have to do their certain allocated treatment, and do whatever the medication is that is needed. But how do we follow up with that medication that has been given to them on the streets or wherever they go? Like, and if they don't have it, then they're gonna go back into this cycle. So I'm really interested to see like what interventions we can do in order to, help, like, bridge the gap of the circle, right? Like, we want somebody to be healed, healed, or just at peace with where they're at, and to constantly have to be in that circle is a strain of resources, a strain on the patient, and a strain for those that are trying to help them, because at times we feel hopeless. So that's going to be my thing, and I'm going to really work hard at finding how we can possibly improve this, or I don't know if it's possible, but at least if I can look at evidence-based practices, I can find the material of ways that maybe interventions that can support them in the right direction. Because at the end of the day, we don't want to do this cycle. We want to take that circle and want to break free. So, thank you. Bye.